Hello, everyone. I'm Dr. Renee Mehrra. Thank you so much for joining. Today, my guest is Vaidya G, Marda, Ayurveda doctor with over 3 decades of experience. Vaidya Marda has a master's in Ayurveda, specializing in cardiology and diabetes management. In 2019, he received the coveted Best Ayurveda Researcher National Award from the Ministry of AYUSH in India. Vaidya Marda travels overseas and gives a lot of talks and workshops on Ayurveda. Today we'll be talking about heart disease, which is a leading cause of death globally. According to the Centers for Disease Control and Prevention, every 33 seconds in the United States, somebody dies of cardiovascular disease. So this is an important, critical topic, and today I'll be talking to him about how to maintain an optimally healthy heart. Thank you so much, Vaidya Marda, for joining me today.
Thank you.
So let's talk about some of the signs and symptoms of heart disorders.
It's the cause of concern. More about 20% of the population, or more than that, if I take WHO predisposition, dies with cardiac conditions. So it's one of the major cause of death. Now, when we reach to this, it's a big subject, but I'm just telling you how to understand an unhealthy heart, in fact, because cardiac conditions, they have different types of cardiac disorders. There are some chronic, there are some acute, there are some like rheumatism, some valvular defects of various kinds. But just to get a first-hand information, if you are suffering from particular things, then you should start thinking about heart. So one of that is unexplained exertional breathlessness. Means you used to walk like a kilometer without any problem, and now suddenly in last few days, if you start to feel a little bit breathless, walking the same distance, 1 kilometer, you should start thinking of. It's not only cardiac, but cardiac is one of the major thing in this sign, which you could notice on yourself. Along with that, randomly acute chest pain with exertional dyspnea, or chest pain with referring to different other body parts like jaw, like eyes, like shoulder, left side. So referring chest pain. Along with that, difficulty in breathing or exertional difficulty, as well as discomfort, feeling discomfort. Sometimes people feel nauseatic, something like that. So this could be the primary warning thing, especially if it is related to vessels or what we call CVT.
But many women may not have those symptoms of breathlessness or chest pain. They may just have nausea, and that also could be one of the warning signs.
Yeah, absolutely. But it's not, because see, these symptoms can easily replicate in acid peptic disorder also. So there are particular things. If you are having discomfort, if you are having nausea with, for example, let's say fatigue, or if it is associated with another set of symptoms like swelling in feet or swelling in face. So there should be some associated symptom, not one, because nausea itself could be a marker for many other diseases.
Right.
Yeah. Similarly, like exertional dyspnea could be a major marker for cardiac condition. But if you are obese, for example, imagine if you are overweight, then you could also feel breathless. So, but when I'm talking, it is a set of symptoms. And there, especially, which will be interesting to know, that when I studied my cardiology in post-graduation, and when I was doing dissertation, I note down that most of these people have difficulty in expiration, not really inspiration, expiration. So this is a pinpoint, for example. And this is exactly what I found in Ayurveda mentioned. So it's really surprising and interesting for me. So this is first set, like chest pain, etc. Along with that, if you have swelling, if you may have cold feet sometime, you don't have any other symptoms, but you just have cold feet. You consider it as a bad circulation. Many people think I don't have good circulation, I have cold feet. But then again, circulation is the job of heart. So it goes to unhealthy heart, for example. Or sometimes people just feel like fatigue, unexplained fatigue. There's no reason, but they start feeling fatigue. So this could be indicative. Of course, it's indicating with muscles, but then again, heart, myocardium is a muscular structure. So there are different things, but the most uh, concerned thing where you definitely need to pay attention to is the first set, which what I told you: chest pain, exertional dyspnea, swelling, nausea, discomfort. This you really need to pay attention, or referral pain. This you need really to pay attention to.
What about family history? I know that you actually started doing research in cardiology because you had a family history of heart disease. So do you believe that genetics play a very dominant role if there is somebody who has got a predisposition to heart disease, but maybe leading a very healthy lifestyle? So how does environment and genetics play over here?
Absolutely. Well, in my case, it was like we brother and sister got the cardiac scenario, not really parents, but still it was in a family tree. So genetic predisposition, which is nowadays, it's more coming up, because if you go like 30, 40 years before, nobody was thinking that all the cardiac condition could be hereditary or with the family. But in last 30, 40 years, there is a lot of observation that the genetic predisposition or the family tree plays important role, because absolutely when you are developing your body, it's coming through your parents' genetics. And if they have some issues which could be transmitted, then definitely you are going to get. And so cardiac conditions are one of that. So definitely you will have a role of your hereditary or genetic scenario. Now, sometimes or particular condition you may not have the genetic predisposition, but major cardiac condition you have. Along with that, environment, what you just mentioned, is another important thing. And environment plays a bigger role nowadays than any other known reason with cardiac conditions. For example, just to give an example, most of the Asian immigrants in European country are prone to get cardiac condition. So the change in the weather or temperature scenario, which is a part of environment, could alter and make them prone to cardiac condition, for example. So this is a very simple thing we think, but it's not really simple. It triggers some other mechanism. Now, if I have to see the environment part, again, there are certain, like after COVID, we are more careful about these things, but there are certain environmental invaders that could lead to cardiac insufficiency, maybe through uh, respiratory insufficiency, or maybe through digestive insufficiency. But ultimately, it will lead to cardiac condition, which is not really paid attention to, at least pre-COVID scenario. Now people are more paying attention to. So environment plays important role. Another thing in environment, for example, change in weather. For example, if you go to again in Europe, in French area, you will see that when the summer begins, they have particular things called jomblod, heavy leg syndrome. So this is something like their feet or legs become heavy or swollen. Actually, the weather is changing from cold to warm, but then it also alters the circulatory scenario. So environment really play the role. Another part of environment is the impact of environment on what we consume.
Mhm.
not necessarily only food. There is water, there is air, there is exposure to temperature variation. So it's not just food, but what we consume is strongly impacted by it. And environmental factors are now becoming a major player in many diseases, including cardiac conditions.
So we're talking about exposure to toxins, heavy chemicals, smoke, alcohol, lack of physical activity, sedentary lifestyle, poor food habits, processed food, junk food. All this contribute, and especially one has a genetic predisposition to heart disease, that only exacerbates the condition.
Yeah, absolutely. But I want to figure it out a little different approach. For example, it's easy to blame to these toxins we consume or alcohol or etc. Okay, it's easy to blame. But what we forget is this is consumed by our body, and our body is transforming it to unhealthy cardiac assimilation. Because, for example, two friends are consuming the same thing. Let's say two smokers, they smoke. One is getting earlier cardiac scenario, another may not get. So why it is happening? Because our body also require a particular direction, even if you are exposed to this condition. So your body is also a trigger, equal culprit. Body gives a platform. This is one thing. I can explain that more later. Second, there are particular habits, like not just smoking. For example, many times we suppress the natural urges. Like I want to go to PP, but you are taking my interview, I'm in front of camera, so I'm holding. Now, what we forget that this holding could trigger the reverse mechanism, like a reflux. And when the reflux will go up, it will put pressure on diaphragm, it may put pressure on heart, it may put pressure on lungs. So there are certain natural urges. Holding unnecessarily of these natural urges could lead. How I get this? Because when I was doing my dissertation, because 39 acute myocardial infarction patients in my dissertation, most of them, means out of 39, 37, they have started the episode either early in the morning or late afternoon, and they were felt that they were flatulent, so they have constipated, it was not evacuated, and the trigger started. So then I again started to restudy, and then interestingly in Ayurveda, you can find like there are 13 natural urges. Out of that, 9, if you suppress forcefully, not one day, continuously for few days, could lead to cardiac condition. So behavioral pattern.
Can you name those 9 urges that are very important?
Yeah, there are. Yeah, for example, as I told you, holding platters, holding urine, holding feces. This is one. Holding burp, holding, for example, you're doing exercise and you want to hold the breath. Sometimes the breathing exercise where you force yourself to hold when you have the increased rate of breathing because of exercise. That kind of thing. That's what I want to point it out. For example, post-COVID, many of my cardiac patients I advise don't go immediately for cardio, because this kind of exercise after COVID, it's really creating some extra workload for heart, and with the density of blood, many people may lead to cardiac condition. When you do some exercise and you hold the breath, what in Ayurveda we call it Shamashwasa. So when you do some like workout, for example, in Nadi Shodhana, you're not doing workout. Okay. But if you do workout and then you do breathing exercise, you hold. Okay. So these kind of things.
So in a workout, if you're holding your breath, that can create issues.
Yes, absolutely. Absolutely.
And that's on a consistent basis, like you're doing it regularly for months, and that can have an adverse effect.
Absolutely, absolutely. Not in one day, but regularly. And that's what I'm telling you. When I do this, I did an experiment with my friend Philippe Fayet from France and Germany. We created a website we write these 13 natural urges, and we told people, do you hold this? And if you hold this, what symptoms you think are because of that? And it will be surprising, 700 people participated, and we got like 83% of people giving the symptoms which is described. So people are noticing, but they are not thinking it's a disorder. But if you continue like that, probably it will bring the disorder. This is something that natural urges, handling the body properly. For example, if let's say United States is a little bit what we can say developed country, but country like India, Africa, etc., where people has to work and still they have to eat junk food. Okay, but then why surprisingly the episodes of cardiac conditions are less than developed nation? Probably the answer lies in the conversion mechanism of the body. So that you have to think that food is one thing, one culprit, but the way body transform it is another culprit. That's why diabetes is metabolic disorder, or hyperlipidemia metabolic. Why we call it metabolic disorder? Because we are not able to transform or consume it. So this also need to pay attention to. So changing a little bit of lifestyle and a little bit of exercise, etc., habit could really help you to prevent from the exposure of cardiac disease.
Let's talk about women's health, coronary microvascular disease some women have, and could be because of low estrogen levels. What's your take on that?
For us, the part of that, what we think, for example, woman has a special condition. Every month, there is a monthly cycle or menstruation. And this menstruation cycle is happening with the vessels, blood or vascularity scenario. Okay, so this one mechanism is available there. Now, if this mechanism goes well, this is an example I'm telling you, there are multiple. If it goes well, nothing will happen. But imagine if this mechanism disturbed. Like, for example, many women come and, oh, in menstruation, I'm having clots. Why clots? We don't think at that moment. We just think it as a menstrual disorder. But then why clots? Whether the vascularity is increased, reduced, microvascularity, whether the fibrinogenesis is increased, reduced. So imagine that if some woman is having, let's say, menstrual clots, why? Probably she will develop some clots in the cardiac vessels. Probably. So in this way, we have this kind of thinking behind. And another thing, and that's where I really, that's why sometimes I get surprised with Ayurveda. Ayurveda is a science which says that this phenomenon of menstruation is linked with what we call rasa dhatu. And rasa dhatu, one of the site of rasa transformation system is heart. So menstruation, rasa, heart. There is a link. So this is another way. Like one way I explain you menstruation clotting is another way is like there is a link established. And with that, we definitely work. Now, third and last thing, menopause, weight gain, osteoporosis, we think that. Now, we also know that obesity or weight increase is a comorbidity with cardiac condition. So some hormonal changes leading to certain things, which could be the friend of cardiac disease. And this is a natural process we call, because every menstruating woman has to end up in menopause. So sometimes natural process could lead to some cardiac scenario with reference to hormonal changes. So there are multiple aspects with woman health and cardiac scenario. And one common thing which could be more in certain countries, certain not just country, continent, with relation to woman is stress factor again. Stress hormone heart. That is another link. But it's not common everywhere, so that's why I didn't mention before.
Yeah. But like any of these medical conditions, both men and women need to see their physician or the cardiologist. We're talking about some Ayurveda tips and Ayurveda perspective. So let's talk about some of the tips to maintain an optimally healthy heart, both in men and women, to improve circulation, reduce blood pressure, using food as medicine, exercise as
Absolutely.
medicine.
Absolutely. Because the goal of Ayurveda is you should not be sick. You should remain healthy for life. That's the goal. So definitely we want you to be healthy with healthy heart. That's the one condition. If at all you exposed to some disorder, then there are certain things. Absolutely, heart is considered as one of the fatal organ or marma, what we call in Ayurveda. So you do need to see your specialist, your doctor, your cardiologist for sure if you are having conditions, stronger condition, definitely. So these tips are just to help you to reach to your specialist in a way if there is some symptoms. And other part is like a prevention, like again 40-50 years before there was a big thing going on which is in fact initiated from United States, Dean Ornish theory of reversal of heart disease. This was a specific thing when I was student. It was going on in the big hospital where I do my post-graduation dissertation, and there were a lot of people coming for reversal of heart disease with Dean Ornish theory. So, and what was that? That contains a lot of lifestyle advices. So, in short, first, the tips for certain things if you expose to certain uh, like symptoms. For example, when people used to call me in the middle of the night, having acute chest pain, breathlessness, discomfort, etc., what I tell them is simple. Every Indian home has two spices in their kitchen. One is ginger, one is asafoetida or hing. So I just tell them, take ginger, put it in water, apply on your chest, and go to the hospital. Or also, if you have asafoetida roasted already in ghee, because we use ghee in cooking, or just roasted, take a piece of asafoetida, put it in mouth, and go to the hospital. Why I advise this? Because if you go to botany, gingiva officinalis is a vasodilator. And what you need in that condition is vasodilatation. And if you look at the Ayurveda literature, also it is a cardioprotective. Same asafoetida. If you see the chemical composition of asafoetida, it's vasodilator. And if you see in Ayurveda, it's Tikshna and Hrudya, Ayurveda heart protective. So I tell them, because if you go to many medicine book, they write that 75% of patients dies within 45 minutes if they don't get medical aid. So these tips I give them to survive and to reach to the hospital. And that works fantastic. I'm telling you that works fantastic. And that's really helpful. Now, this is like acute condition. Imagine if somebody is having in respiratory arrest, for example, oxygen is dropping down and getting unconscious. Again, because there, what you need is to give maximum amount of oxygen released in that particular moment. So there are three things I always advise. Well, it works in many patients, but sometimes if the condition is acute, I'm not seeing the visually the patient, so it may not work. Because why I do this again. My grandpa, when I came to Ayurveda, my grandfather told me to bring some camphor because he wanted to go to Vaishno Devi, which is a low oxygen area. So I asked him why camphor, because people have a tradition that they rub camphor or they smell camphor and go and they get good oxygen there. They don't suffer. This idea clicked in my mind. So in this situation, again, in most of the Indian home, you have camphor for the worship. So I tell them just rub the camphor, let the person inhale by nose, because camphor is evaporating, camphor is creating space, and camphor helps to give more release of oxygen, deriving more oxygen. So this is one simple thing every Indian home has. So I have that possibility to advise them. Second, again, the same ginger thing with pepper means more penetration. We rub on the chest, and we do this kind of up and down movement in the chest.
CPR, we have to give CPR too.
CPR, yes, we do that. So these kind of things which are not really a medical, but still medical and people can do at home, which we advise them. And as I told you, it helps, let's say 50-60% people, they survive. Sometimes they don't. Because I'm not there, I don't know the severity. I just advise by phone because most of times this happen on call. So these things works. Now the last part, prevention type. See, again, two things. What you should not do, many books are telling you. What you should do, there are less books are telling you. First thing, if you want to prevent you from cardiac condition of any sort, you should have a little bit disciplined lifestyle in terms of eating time and eating habit, not just content. Content, of course, some junk food or fried you should not, okay. But for example, if your country has, let's say, 4 seasons, like in some of the states in United States, you have like 8-9 months cold and 3 months or 4 months hot. So as the temperature differences vary, you should change your eating pattern, you should change your content. If you're not changing, you're exposed to some disease, including cardiac disease. For example, in summer, as it's hot, it's taking moisture from your body, it's reducing the volume. You may expose to cardiac condition probably. So you should have 2 liquid meals, breakfast and afternoon snack, and you should have 2 solid meal, even dinner soup, for example. Whereas in winter, you should have 3 solid meal, breakfast, lunch, soupy dinner, but dinner, and afternoon snack, maybe liquid. It's a very simple change. But this matters the most. In summertime, you should have gentle exercise or non-exhaustive exercise. In winter time, you can have exhaustive exercise to build your muscle or to train your heart, for example. Then certain spices or certain food element could help you to keep your heart going well. One of the things I already told you, ginger and asafoetida, but there are more, but then again, there is a kind of disclaimer that if you are already on aspirin or etc., then like spices like garlic, you cannot. But garlic, one of the important spice, which is cardioprotective, which has certain amount of certain immunomodulation, certain things are there. So garlic could help you in a cooking form, in a fried form, not raw.
If they can't take garlic, so is there any other substitute?
This is one, garlic. If you cannot, then there is celery. Not as strong as garlic, but celery could replace garlic. In this aspect I'm talking about, not every disease, this aspect. So this, then if you, let's say, if you have circulation issues, then again there are some, for example, coriander, either fresh leaves or seed, or cumin coriander tea, decoction, infusion, because coriander is a bladder cleaner and a sort of diuretic, anti-inflammatory, reducing the swelling, so as cumin. So cumin coriander decoction, just drinking like a tea, could help you not to have issues with circulation. It's not everyday thing, but it's, you can do as a change in like 2-3 days in a week. Why not? Anyway, you are habitual to taking green tea, herbal tea, whatever. So why can't this? Normally, what we say, if you are doing, we advise people, today is a coriander tea day. So we tell them 2 spoons of coriander seed, if they have seed, 1 spoon of cumin. So 3 spoons, 3 glasses of water, boil it, make it 1.5, and drink half cup in the morning, half in the afternoon, half in the evening, as like a coriander tea day, for example. Now, if you don't want, then you can just reduce like half a teaspoon of coriander, quarter teaspoon of cumin, a glass of water. You can make 1 dose, half a glass you drink. It's up to the way you want to consume.
Do it twice daily?
Yes, once or twice daily, why not? You can. For example, I have like many people last 10-12 years, they're drinking coriander tea every day.
So
Coriander
2
tea.
times in a week would be good, every week?
Yeah, that's fine. That's not an issue. So this is like a support, Then there are some other spices which you could add in this tea as well as you can have in your food, like dry ginger, not fresh. Dry ginger is more supportive to heart condition, or more anti-inflammatory, or more pain reducing, and more improving the circulation. Clove, that is one of the very good circulation spice. Then dry ginger, clove, and cinnamon. Cinnamon, or in Ayurveda, we use a very good combination, what we call trikatu: dry ginger, black pepper, and long pepper. This is used for cholesterol, metabolic disorder, etc., etc., the medicine. So sometimes you can
Are
drink
they
this
not
kind of.
heating? If you are like a pitta person, is it not
No,
heating?
because the dry ginger is not that heating. Dry ginger is cooling, for example. Fresh long pepper is snigdha and not that heating. But of course, the dosage are low, or you just make a tea. You're not going to have a spoonful of that. It will
Right.
burn your tongue and it will make you like a hot flush. So that's why, as I told you, you could use this in food rather than consuming separately. You can fry it. It makes a really nice taste. You can fry and put it in the soup. Why not? Like I told you, garlic fried. So fried or using in cooking will really help you. So this type of spices you use. Then, if you have family predisposition and you know that you are prone to these kind of things, then I advise one simple thing. As I told you, the timing of the food changing in summer, winter. Similarly, for example, instead of yogurt or curd, go for buttermilk. Instead of Indian sweet saturated milk sweet, you go for porridge. Don't go eat sticky fruits like banana, rather than you go more for juicy fruit. Even in winter time, if you have a strong predisposition in your family, or you have to modify that, like banana with honey and cardamom, for example. So you compensate. You compensate. That is another thing. Pomegranate is one of the very good fruit, which is again cardioprotective, for example. So these kind of things we advise, or avoid fried stuff. Everybody will tell you. But if at all I have to eat fried stuff, I'm obliged to, for example. Then what we tell them is, like I told you, this trikatu thing. So you can pin in some spice, like you can pin in black pepper and then fry. Or you can pin in celery, appium, and cumin and then fry. So minimize the bad effect of that, because you can't stop everybody eating, because you are human, I am human. I also sometimes tend to test. Then another thing, imagine you went to a party, you have eaten a lot, and then you regret, oh, I have a cardiac condition, why I eat? Don't worry. Just compensate by having next meal, just soup. You produce extra thing, but next meal, when you have a soup, you compensate. You don't accumulate. The principle is don't accumulate, compensate. And that's what we advise people, because this is something which we need to know, that you can't just blame on food. You can't just blame on alcohol. You can't just blame on smoke. The way you do, for example, and this is really, really funny. Ayurveda is the science who says, Ashtanga says, Madhyam na payam. Nobody should drink alcohol. This is the first thing, okay? But payam salpam subho variva. If it happens that you are obliged to drink, then there is a method of drinking. Healthy method of drinking alcohol. But that should not be everyday practice. Huh?
Yes.
If once in a while, this is the way Ayurveda look at. Ayurveda gives you solution. So you could still enjoy the life without hurting yourself.
It's all about what you eat, when you eat, what season you're eating, and most importantly, mindful eating. Mindful eating is so important.
Absolutely, because see, don't regret and do second mistake. You have done one mistake by eating wrong food,
Right.
and don't regret and create second mistake, rather compensate. That's the thing. And so you have to consider human body platform equally responsible for the food or habits.
Yeah. And let's not forget the emotional heart, how to maintain a healthy emotional heart as well.
So that is most important thing, because Ayurveda is the first science in the world who consider or give more importance to mind than physical body for any disease. Ayurveda says, and this is a bit exaggeration, but Ayurveda says that every disease begins with mind. Prajnaparada, committed crime of intelligence. So Ayurveda gives bigger importance to mind. Mind stays in heart. So emotional heart diseases, because mind stays in heart and work with brain. That's the concept Ayurveda follows. So emotional heart diseases is a big issue. And so again, that's something which Ayurveda advises you, that everybody will tell you control, suppress your emotion. Ayurveda says no, control is bad. Live with it. Ignore. Art of neglect, ignore or accept. Dhi dhairya atmaryu. Accept. You will have courage to face and you will realize. So suppression, control will not work. But acceptance, neglection, or live with it will work in emotional heart.
Before we conclude, what is your research now in cardiology, working on some research?
Yeah, well, I'm not working, I'm now working on what we have noticed in last 2 years, that there is a sudden increase with vascularity disorder and death due to cardiac arrest, or sometimes even cerebrovascular scenario. And this happens post-COVID, and it's worrisome because more younger generation is. So we are now working on kind of cardiovascular disease, not really other disease. Before I was having a project with valvular defect, rheumatic heart disease, but I have stopped that in between because COVID time everything stopped, and then this new thing come up. So now we are working on, you can say, cerebrovascular or cardiovascular accidents and solution. And we are really working, and it's helping, because it's just in a primary stage, but the amount of platelets or amount of the D-dimer, the inflammatory marker with fibrinogenesis, the amount of this INR ratio, etc., there is a substantial reduction with spice mix. It's just the primary thing. I'm not telling that it's going to stop the cardiovascular accidents, but definitely it may alter the vascularity or fibrinogenesis. This is what we see now with the spices in the primary stage.
Yeah. And you also going to be coming to US for a tour across many cities, and a speaker at the NCAM conference at the National Consortium of Ayurvedic Medicine in Orlando, Florida, from October 27th to the 29th. You're one of the speakers.
Yeah, I will be there in that conference in Florida, and also I will be going to different other cities like Minnesota. We are doing Marma Point, and also we are working on pain medicine or pain management, in fact, because this is the second largest selling thing, pain drugs. First is psychological, but second largest is pain drugs, and pain is a big issue. And there we are working on pain management, Marma Point, and also in NJ and New York, we are setting up some sort of talk like public health.
Well, thank you very much. Vaidya G, Marda, Masters in Ayurveda, specializing in diabetes management, cardiology. Wish you all the very best in your tour to the United States. I'm Dr. Renee Mehrra. Thank you so much for watching. Stay healthy, stay positive.